It is advised each and every pregnant woman to shouldn't take any different kind of medication during the period of pregnancy, because some drugs can impose stress to the growing fetus and also to the mother. So it is advised each and every pregnant woman to shouldn't take any different kind of medication, because some drugs are contraindicated during the period of pregnancy. You see, pregnancy is classified into three periods or three trimester, that are first, second, and third trimester. Each trimester it include 3 months, that is to say, first 3 months of gestation that we call first trimester, followed by next 3 months that we call second trimester, followed by next 3 months that we call uh, third trimester. So some drugs can impose stress to the mother and also to the growing fetus, most especially during the first trimester, that is during the first 3 months of gestation, because that is the period through which organs of the growing fetus used to develop. Now let's look into some group of drugs and their effect during the period of pregnancy, both to the growing fetus and also to the mother. Number one, we have a class of drugs that we call tetracyclines. Tetracycline can impose stress to the child because they cause staining of teeth as well as poor bone growth or bone development. Number two, we have anticoagulants. Anticoagulant example like warfarin, heparin. So these drugs has ability to causes skeletal abnormalities as well as heavy bleeding during the period of the pregnancy. Number three, we have some classes of drugs that we call non-steroidal anti-inflammatory drugs, which we formally call as NSAID, and also angiotensin combating enzyme inhibitors like lisinopril, captopril. So these drugs causes oligohydramnios, that is low amniotic fluid, and we all know the importance of amniotic fluids to the growing fetus because it allows free movement. Number one, it helps in maintaining of fetal temperature, and also it supplies nutrients to the growing fetus. And during the period of labor, it flushes the bad canal, and so on and so on. So this growth of drugs that we call NSAID, like ibuprofen, and also angiotensin combating enzyme inhibitors like lisinopril, causes high oligohydramnios, that is low amniotic fluid. So number five, we have alcohol. So taking alcohol or drinking alcohol during the period of pregnancy can impose stress to the developing fetus because it causes a condition that we call as fetal uh, alcohol syndrome. Number six, we have some drugs that are used in the treatment of ulcer. So this drug, I will not mention it because it can induce labor, to which some people can misuse my information and commit some crime that are against the law. Seven, we have cocaine. Cocaine can cause placenta abruption as well as fetal death. So it is advised to shouldn't take any cocaine during the period of pregnancy. Now, some people will start asking, so what are the example of drug that shall be used or can be used during the period of pregnancy? We have at least 7 drugs which can be used to maintain the period of pregnancy and also to sustain the pregnancy. So these drugs include: number one, we have iron. Number two, we have folic acid. Number three, we have calcium. Number four, we have vitamin D. Number five, we have iodine. Number six, we have zinc. Number seven, we have omega-3 fatty acid. So all these drugs that I made mention are very important during the period of pregnancy because it helps the growing fetus as well as the mother. But uh, these drugs that I mentioned shouldn't be taken randomly. There are certain amount of dosage that should be taken each and every day or each and every certain period of time. So you shouldn't take them randomly. You should go to hospital and ask some health providers to provide you with a lot of information on how to take such medication. Thank you. My name is Mustapha Suleiman. Follow, like, and share. Thank you.